Hello, my name is Allison Brenner. Welcome to the Navigator Tool and med-rec tool overview. To start, I would like to introduce you to the Ann Arbor deployment team. Gabe Solomon, Danielle Hoover, Joe Granata, Yehuda Bashar, Karen Bellinger, and myself.
For this presentation, I'm actually going to be talking about two separate tools that work together. One of the tools is called the Navigator tool, and its job is to help build notes, specifically the H&P note at admission and the discharge instructions and discharge summary at hospital discharge. The second tool is the med-rec tool, and this facilitates performing med-rec in both the inpatient and outpatient settings. For inpatient, it is part of the Navigator tool. Each facility may choose to use only the med-rec portion, in which case they will use the tool to paste medication lists into their current CPRS notes. Typically, when a patient is discharged from the hospital, the intern must break off from rounds and is rushed to complete the discharge summary in one sitting. There is no way to save the document to work on in stages. The idea for the Navigator tool is that it is a web-based tool that allows all members of the team to complete their notes collaboratively over the course of the admission. Now, the student, pharmacist, and physician can start planning for discharge on day one. The med-rec tool is incorporated into the process. The hope is that documentation will be more timely, complete, and accurate, and that there will be fewer medication errors. The tool can also be customized to focus on quality measures that each site might need to work on. Ultimately, the tool will create nicer-looking outputs for patients, including nicer-looking handouts and medication lists. This is the H&P tab of the Navigator tool. It is designed to be thin so you can split your screen with CPRS. It is broken down into traditional sections, such as HPI and review systems, and the goal is to bring all of the information you need, such as vitals, labs, and studies, to your note automatically, so there's less copy and paste. We are trying to help the user follow evidence-based guidelines for issues like DVT prophylaxis and medication reconciliation. The med-rec tool is a part of the H&P tab. This is important because CPRS makes it difficult to compare medications when someone is admitted or discharged from the hospital. For example, at admission, the clinician must compare meds in the inpatient tab, non-VA tab, outpatient tab, and if the patient has meds from another facility, they also have to open up VistaWeb or Joint Legacy Viewer. The idea behind the tool is that all medications will be combined into a single master list. This includes the outpatient, inpatient, remote, and non-VA medications. Medications are ordered alphabetically, but also by indication, so you compare similar types of medications side by side. For example, all of the diabetes meds will be listed.
In the next few slides, we will show you how to utilize the tool to perform a gold standard medication history at admission, and how the tool can be used by the physician and pharmacist to work collaboratively to ensure medications are accurate at admission.
To complete a gold standard medication reconciliation at admission, there are three basic steps. First, you create the best possible pre-admission medication list. Second, you order your inpatient medications. And finally, you double-check your work. This is the med-rec tool for admission. You can see that it will aggregate medications from any source around the country. You can also sort purely alphabetically or by status. The indications are imported automatically and are in patient-friendly language. If you want to change an indication for a particular patient, you may simply type over it and it will be saved for that patient from then on. You can also see there's a column for total daily dose, and if you want very detailed information, you can click on the magnifying glass. Importantly, there are several filtering options. We take the supplies, such as alcohol prep pads and syringes, out to declutter the list. You can add them back in if needed. You can also filter out remote medications if they aren't relevant. If you don't have a computer at the bedside, you can also do this on paper by clicking here. This is the paper version of the admission screen. You can use it as a template for generating your initial inpatient orders. When your CPRS orders are signed, you can double-check your work. The tool will summarize the changes made at admission and put the medications into various columns. These include newly started medications, medications that were continued, medications that were changed this admission, and medications that were held. This is an important step to make sure you didn't make any errors with your medication orders at admission. This is what the medication looks like when you paste it into CPRS. It is unique in that it shows what medications a patient is or isn't taking, which medications they are not taking as prescribed, and if the orders are in, it will automatically tell you what was done with each medication at admission. Once you complete the Admission Navigator tab, you can paste a well-organized and nicely formatted note into CPRS. The tool will also generate metrics, such as usage rate and med-rec accuracy, so you can track how each team or individual is using the tool. Special focus or feedback can be given to teams that need it. Now I will show you how to use the Discharge Navigator and med-rec tool at hospital discharge. The Discharge Navigator tool is a web-based tool that allows the team to complete the discharge summary over the course of an admission. It can be frustrating to type mostly the same information into the patient instructions and discharge summary notes. The tool will take the information and create both notes from the same user input. The tool is broken into different tabs, such as an instructions tab that includes basic team information, issues for follow-up, red flags for returning to the hospital, and other restrictions. It is based on the Joint Commission and Society of Hospital Medicine requirements for discharge summary information. There is a follow-up section that shows scheduled appointments, as well as appointments, studies, labs that need to be scheduled. There is a hospital summary section, which includes a primary diagnosis, secondary diagnosis, hospital course, and exam sections, with an optional section to include detailed wound description and wound care. The labs section automatically brings in labs from CPRS, so there is less copying and paste. It shows the admission and discharge labs automatically. This section can be customized to include whichever labs the user would like to include. There is also a section on blood cultures and pathology reports. There is a studies section, which automatically brings in the impression from selected studies and procedures from CPRS. The user can decide which results are displayed and may edit them if needed. There is also a Reminders tab that can be customized to include various quality metrics. The metrics in this section are determined by each individual facility. The med-rec tool also has its own tab. At discharge, the user will designate what happened with each medication during the admission. They will designate medications as either new, changed, held, or stopped. Before the discharge, the MD and PharmD will double-check the medications to ensure the medications are accurate and the instructions are clear. This is the double-check screen. It is broken down into 6 main categories, including new medications started this admission, continued medications, changed medications, held and stopped medications. There is also a column for active inpatient medications that were not continued in the outpatient setting. The tool will also point out potential errors and give the user a score. For example, you may have indicated the patient should stop a medication, but it is still listed as active in CPRS. This double-check screen can be used to generate a PharmD discharge note, or it can be pasted into the patient instructions. One popular feature of the Navigator tool is the Discontinue Remote Medications feature. It can be very difficult to discontinue medications at another facility. This can be dangerous as the patient may still pick up the discontinued medication prescription. Using the DC Remote Medication button, the tool will generate an email to the prescription cancellation email address of the remote facility. In the past, this would require a phone call or trying to find the correct email address, an extra and time-consuming process. At the end of the process, the patient will go home with a nice-looking medication list that clearly summarizes what happened with their medications during the admission. The list is broken down into the different sections described previously. The list will also include patient-friendly indications for each medication and any notes that were typed into the tool. The same medication list will be pasted into the discharge summary and patient instructions. It can be difficult for notes printed from CPRS to be in a patient-friendly format. There is no ability to underline, create tables, or bold certain words. The tool has the option to print better-looking discharge instructions and discharge summary documents that can be given to the patient prior to discharge. Now I'll go over how the tool is used in the outpatient setting. In the outpatient setting, we use the tool to print pre-appointment medication lists, to print after-visit summaries, to write non-VA prescriptions, and to print multiple different formats of the medication list. This is an example of the old list we used to print. It was very long, included multiple abbreviations. The meds were often listed as suspended, which was confusing to patients. It did not have any indications, and it had multiple sections for remote and expired medications. This is an example of the new pre-appointment medication list. You can see that it is more clearly laid out and is organized by indication, so similar types of medications are listed together. It includes any VA source around the country. It gives refill and last fill information to judge compliance. The LPN typically reviews the medication list prior to the patient's appointment. There is an option to print a customizable after-visit summary that will include PCP information, vital signs, vaccination history, future appointments, things ordered at today's appointment, and a customizable medication list. Writing non-VA prescriptions in CPRS can be cumbersome. The tool allows you to quickly create a non-VA prescription that can be printed and given to the patient. You can copy the information into CPRS as well to document what was given. The tool can display medications in multiple different formats, including a wallet and pillbox view. This is the pillbox view. It is arranged like a pillbox planner with morning, noon, evening, and bedtime options. Prior to this, the geriatrics clinic was doing this manually in a Word document. The tool will automatically populate the boxes based on the medication directions. Now I will go over some of the results we've had so far. Uptake in VISN 10 has been good. To date, we have more than 5,000 unique users throughout the VISN and have used the tool on more than 1 million patients. We completed a pilot study of using the tool at admission. We used the tool on one of the 4 resident services. The control group, which did not use the tool, had a 24% error rate and had 14 potentially serious medication errors. The intervention group, who did use the tool, only had a 6% error rate, which was an absolute risk reduction of 18%, a relative risk reduction of 75%, and a number needed to treat of approximately 5. When we surveyed our residents here in Ann Arbor, they either completely or mostly favored the discharge navigator over the old process. The residents were also more satisfied with their medication reconciliation process using the med-rec tool over traditional CPRS. They were more confident in their initial admission orders and discharge orders. Since we have implemented the tool, we have had significant improvements in our inpatient EPRP data. We've also had improvements in our outpatient med-rec EPRP data. Thank you very much for taking the time to watch this video. If you have any questions or concerns, please don't hesitate to give me an email. Thank you.